canceled and changed to June 29th.
Instead of 3 weeks, Rochelle Eisen's second vaccine dose is now scheduled 4 months later.
I think people that are elderly and can't wait 4 months for the second vaccine because they may not make it.
The Eisens are waiting for shots due to a guideline issued earlier this month, a guideline that could soon change.
Now they're going to be meeting about it, and they're going to be looking at it in great detail.
They are Canada's National Advisory Committee on Immunization, or NACI. Based on emerging evidence, the committee advised the second dose of COVID-19 vaccine could be delayed up to 4 months, allowing more people to get first doses, arguably saving lives. But critics say delayed dosing is putting older Canadians at risk.
What we're learning now is there are certain subpopulations that probably we need to think about having a little bit more nuance in terms of this guidance.
This small study looking at over 150 cancer patients in the UK is preliminary, but the research suggests after receiving their second dose of Pfizer vaccine 3 weeks after the first, 95% of cancer patients had evidence of an antibody response to the virus. That number fell below 40% when patients waited 5 weeks between doses. But experts insist antibody testing doesn't tell the whole story.
There's not a test that says, yes, you're protected and no, you're not. At this point, we don't have a correlative protection.
Meaning it's not clear what level of antibody response is needed to attack this coronavirus in order to protect us. Still, NACI says it will look at all of the data to date and may alter its 4-month delayed dosing guideline in the next week or two.
So we're hoping that maybe it'll change.
Eisen says she's not trying to jump any lines. She just wants to feel safe. Christine Burak, CBC News, Toronto.
Quebec's top doctors said today that for one select group of recipients, second doses shouldn't just be delayed, they should be skipped entirely.
Si vous avez déjà reçu, vous avez fait la maladie.
Dr. Horacio Arruda is recommending that for those in Quebec who got infected by the virus, one dose of vaccine is enough. Some studies have suggested that for building immunity, a natural infection followed by one shot is as effective as 2 doses of vaccine.